You can start, okay? No, you can stay here. Bienvenidos a una clase de hidroterapia en donde Brandon, que nos está acompañando en esta tarde, nos va a explicar la historia, los principios y ejemplos de cómo podemos aplicarla en nuestro día a día o en nuestra vida. Brandon nos está acompañando aquí desde Uchee Pines. Nos encontramos en Villa Corona, Jalisco. Y bueno, Brandon, tienes todo el tiempo.
Thank you. Yes, like she said, that we're going to be doing our presentation today on hydrotherapy. And so hydrotherapy is one of God's healing ways that he has given us, one of his gifts for health. It is one of the 8 major principles that that we teach, and here are the 8 of them: confianza en parecer, abre, aire libre, ejercicio diario, luz de sol, un motion de descanso, mucha agua, siempre temprano, and nutrición. So today we'll be primarily talking about water and how we can use that for our health. Ellen White has also gone and quoted to say that if water is used wisely, we can reach or obtain supernatural results. So now we're going to talk a little bit about the history of hydrotherapy. Hydrotherapy is not something new. It has been done for an extremely long time. In fact, back in the days of the Romans, they used hydrotherapy. And specifically the Spartans, who were known for being very fierce warriors, actually had a law in their city that each fighting male needed, by law, to take a hydrotherapy bath every day so that they could be battle ready. And also we have examples of in the Bible, such as Naaman. Naaman was told by the prophet of God that he needed to dip in the Jordan 7 times in order to be cured of his leprosy. Now, question, do you believe that the water alone healed Naaman of his leprosy? No, that was the power of God. But would God have healed him had he had not dipped in the Jordan 7 times and used water wisely? No. So it's the combination of using these natural remedies with the power of God to reach supernatural results. So, and in recent history, we have John Harvey Kellogg, who was very famous in the United States in the 1900s, where he also used hydrotherapy to cure many of the diseases of his day. So he had a big pool there, and now today we're still continuing that tradition. There are many things that we still use today, such as colonics, jacuzzis, steam baths, and so on. So now we're going to talk about the rationales and how hydrotherapy works. Hydrotherapy works in 3 main ways, and that is to increase circulation, to improve the circulation. Also, that it gets the white blood cells ready to fight, and also it helps to eliminate toxins in the body. This will be primarily through sweating. So I want to talk about each one of these a little bit more in depth. So the way that the circulation is going to work is that we're going to use hot and cold to push and pull the blood around to different areas. Then the heat also allows the white blood cells to activate. They feel the heat and they're going to come. And then also, like I said, sweating is going to be the primary action for the heat for getting rid of toxins. So heat also has one major factor is that it's going to increase things and speed them up. While cold, on the other hand, is going to decrease things or slow them down. I'll give you an example. So When we put somebody and we get them warm into a hot bath, their heart rate's going to pick up, their temperature is obviously going to increase, and the blood is going to start flowing. Now with cold, that will do the opposite. It will decrease the heart rate, decrease the breathing, decrease the temperature, and push away the blood. Water is also good in all of its forms, so solid, liquid, and gas. And if you see on the screen that we have a picture of a blood vessel. So whenever we use heat, it actually relaxes the muscles around the blood vessel and allows them to expand, which allows more blood to get through. Adversely, or opposite, whenever we put on cold, it's going to constrict, and that means that we're going to have less blood flowing through that area. So those are their primary actions of drawing blood through heat and pushing blood away through cold. So whenever we put them together, it's called a contrast treatment. So literally, like I've been saying, is that there are, in these different treatments, we're going to draw blood to an area and we're going to push it away. Now, what this is primarily going to do is that blood, the white blood cells, the nutrition, the red blood cells, the oxygen, we're going to call all of that to any area that we need to heal. That's what's going to have the healing principles, is to draw the good blood to the area. Then whenever all those cells do their job, then we're going to push them away with the cold, because they're going to have all these waste products. They're going to have all the toxins. They're going to have all the debris from the injury. And we're going to push that blood out. And then we're going to pull in new blood in and then push the old blood out. And that's the primary thing that we're going to be utilizing in these treatments, is to pull and push the blood. So now, well, I'll also say this, that the father of modern medicine, the one that even the doctors accredit to being the father of their practice, had said, if you give me a fever, I can cure any disease. So we're going to be using heat in some of these to increase the body temperature to be able to artificially make a fever. All right, so now I'm going to demonstrate our first treatment, which is the hot foot bath. So before you come, I'm going to tell them what we need before you sit down, because I'm going to have to put these here. So the first two things you're going to need are a flat sheet or something thin like this. A bed sheet would be good. And something warm like a blanket. All right. Now I'm going to show you how to put these down. We're going to first put, can you hold this for me, please? Okay. So now we're going to put the warm blanket first, because this is going to be on the outside. Sorry. Just like that. Just like that. And now we put the flat sheet. Just like that. All right. So now, sir, if you would please sit. Okay. So you want to have it above his shoulders like this. And we want this flat sheet to be touching his body. That's why it's on the inside. This is going to catch all the sweat. So this is what's going to promote the detoxification. The body uses all of that water to get rid of things it doesn't need. So we're going to trap it in this this flat sheet here. And so if you've seen what I've done here, is I'm going to take that corner and sorry, sir. I'm going to put it right behind his shoulder. Same with this one. Just like that. Now we're going to do the exact same thing with the blanket. Okay. So there we have it. Now he's all wrapped up. Now we want to get his feet into position. Remember, this is a bath for the feet. You know, I'm just going to take these off. That's it. So we're going to put his feet in the bowl. So basically, you can use any container that can hold water that is big enough for their feet. Use whatever you have. Something is better than nothing. So we're going to put his feet in there, and we're going to slide it underneath the blanket. All right. So now what we would want to do is we would have hot water ready, and we would fill up the basin or the vase to his tolerance of heat. So I would take my hot water in a glass, and then I would pull his feet to the side as to not put the hot water on top of his feet. We don't want to burn him. So and then we would put it in like so, and we would keep adding and stirring until it is nice and warm for him. It's nice and warm. Caliente por ti, or es muy bien?
Está bien.
Okay, muy bien. So then we would put it back under the blanket. So you see here, what that's going to do is allow his feet to stay nice and warm, as well as allow the heat to travel up into the blanket. So, and if they're in a cold environment, you may want to take another towel like this, fold it in half, and put a clip in the back so that it would close up the hole there. All right. So now you just want to let them sit there for 30 minutes while also keeping their head cool and wiping away the sweat. So I would have a rag that was in cold water that I would use to keep his head cool and keep the sweat off, as well as when they're sweating, they're losing water. So I also want to make sure that they have water to drink. So, and then that's pretty much how the treatment's going to go. At the end of the treatment, after the 30 minutes, you're going to take, here, you can take that. You're going to take their feet out. Now, again, too, during the treatment, you want to make sure that you keep it warm and do the exact same thing we did to keep the feet. You're going to just come back and put some more in there. But once we're done, we're going to take the feet out. And we would have either another basin, or I would remove some water from this one, and I would pour the cold water on top of his feet. And what I'm looking for is his feet should be red. That shows that the blood vessels have opened and they have become full of blood. And whenever I put the cold water over them, I'm looking to see if it turns a shade back to that the redness starts going away. It won't go away completely, but you just want to see that it's starting to go away. So we put the water over the feet. We put his feet down, preferably on a towel or something, and then put his socks on so he doesn't get chilled. And then that would be the end of the treatment. Let's see. So now I'm going to explain a little bit of the rationale as to why we did this. So this treatment is very good for headaches. And can I just keep you here for a second? So this is really good for headaches or any kind of upper respiratory congestion, because what we're doing is that we're taking blood that was up here and we've moved it into the feet. So what that does is that if the headache is coming from congestion of blood in the head, we've reduced that. But also, when we put the blood back, we do that because if he were to now stand up and all the blood has come out of his head down into his feet, that's when someone can pass out. So we don't want to do that, so we want to put the blood back where we found it, so we cool it off and push the blood back up into the head. So that's how you would do that for a headache. Like I said, if you sit them in there for 30 minutes, they're going to start sweating, so that's good for detoxing. He's going to have an elevated body temperature, which is going to help to kill off viruses and bacteria, so you can help to fight off infections. As well as if he had any cuts or bruises in his feet or any kind of damage, pushing and pulling the blood, bringing the good blood to the feet and pushing it back out would also speed up the healing process. So those are, oh, yes. So some things that you want to be careful with any of these hydrotherapies that we use hot with, is that you want to make sure that they won't burn. So that's when you're applying it, but also you wouldn't want to do this to people who have diabetes or severe diabetes, because some diabetics, they can't feel very well in their legs or in their feet. So there's a higher risk of burning them because they can't feel it. So you'd want to make sure to not do that. Also, if you're doing this to treat cuts or wounds, you want to make sure that that wound is completely sealed before. So if you have anything that is currently bleeding, you don't want to do this treatment because you're going to be pulling more blood to that area. It's just like turning on the faucet and having more water come out. If you have a cut somewhere, you don't want to do that, or a hole somewhere. And the last thing I'll mention for this specific treatment that's really good is for menstrual cramps. A lot of the blood is pooling up in the abdomen, and you can alleviate some of that pain and that congestion by pulling it down into the feet. So, yeah. So now I'm just going to kind of quickly go over how you could apply this to different areas in the body if you wanted to, if you have some pain in your elbow, or if you're in your back, or anywhere else that you can't get your body into a basin like this. See, it's a little difficult. Thank you. What we would want to do is that we are going to make what we call a fomentation. And, oh, let me use these instead. So you would take, yes, thank you. So you would take a towel like this, and you would choose one way of folding it, and then you would roll it up like so. And now this would be full of hot water. And especially if it was boiling hot water, what you'd want to do is take it like this and dip it in and take it out and just wring off the excess. It should still be wet, but it shouldn't drip. Now you could also create this fomentation by setting it in water, putting it in a plastic bag like you would get from a store, and putting it in the microwave for about 5 minutes. That would also get it hot. So now, this is too hot to put on top of him. So what we're going to do is we're going to buffer that with another towel. So like this. So I have my hot towel on top, and now I got my other one. Just like that, like a sandwich. So now, this is going to be warm, but now it's not going to be too hot touching his skin. And now I can apply this to different areas of his body, such as his shoulder. And then I can even wrap him up again. What's most important right here is that you want to keep the heat in. So just like that. And now Here's the other principle for all other hydrotherapy treatments that you're doing with short contrast, is that you want to do this heat for 3 minutes, and then you'll do cold for 30 seconds. So 3 minutes hot, 30 seconds cold. So now this heat has been on there for 3 minutes. We're going to pretend. Yeah, I'll do that. Hold on a second. And I would take another rag that is cold, and he would have, this would be connected to his skin. You know, he wouldn't be wearing a shirt. And then I would rub that cold for 30 seconds briskly like this. All right. And then I would have him wrapped up again, or I wouldn't have that exposed. And now for all these treatments that you do contrast, you can do 3 to 7 times. 3 times if you're healthy, just trying to keep up with your health, just trying to get some good circulation. 5 times if you're sick, and if you're severely sick, then you can go even as far as 7 times. However, always be checking with your patient or with your guest how tired they're getting, because the hydrotherapy uses the body's own resources, its own energy. And so if they're getting tired, then there's no more vitality left to use, and you don't want to overtax their body. You need to let them rest, and then you can go for it a second time. Normally, we allow for about an hour of rest in between treatments. Um, the Like the hot foot bath, it's very mild. It's not very severe. You could do that about every hour, or you could do that multiple cycles. But something as severe as being in the hot half bath, like fully submerged, you would only want to do that maybe once or twice a day at most. So that kind of gives you a range of how many times you could do hydrotherapies back to back. But again, the biggest rule is to check how they're doing. If they don't look like they're doing good, don't risk it, right? So, but hydrotherapy is pretty safe. So, and again, too, so like I said, for the shoulders and things like that, that's going to help them to recover. We can also use the fomentations on the chest. We would have them laying down, and we can put it over the chest. And this is good for like coughs or COPD, pneumonia, um, and the other one, bronchitis. And so that's going to take all that congestion uh, and it's going to pump it out. So we're going to do hot and cold on his chest, and that would help with that. Um, I'll briefly mention this as well. This is just a hot treatment, though. If Now again, he would be laying down, but you can apply a fomentation or a towel to his back and just let them lay on it for about 30 minutes to an hour. And this is really good for insomnia. It relaxes the nerves of the central nervous system and allows them to relax and to sleep better. So that's something you can do. And the last thing that I want to mention is one that I have personally done many times is a facial contrast. Still, remember, it's the same principles as before, hot and cold at intervals of 3 minutes hot and 30 seconds cold. So what you would do if you had a stuffy nose, you have a cold, that you would have hot water with a little bit of salt in the basin. And what you would do is that you would put your face in there. Now you can do this. So, como así? ¿Sí? So you can use a snorkel to breathe, or you can just see, or you can just submerge this part of your forehead down to this part of your cheeks. You have 3 different sinus cavities, one up here, one behind the eyes, and 2 behind the cheeks. So all of that being submerged is going to be affected by the hot, and you can massage with that push and pull all of that constipation, basically, all of that mucus that's built up in those sinus cavities, you can get out. The salt is also going to help to just break up the mucus and kind of get it to flow. But So with that, so you're just basically going to submerge those places into the basin. And then you would have a second one with cold that you would switch into, and you would do rounds of that. You would put your face into the hot water for 3 minutes, and then you would put your face into the cold water for 30 seconds. That water would also have salt in it. And you're going to want to have a tissue nearby so that you can get rid of the mucus. So it's very effective. I think that's pretty much it. So thank y'all for your time, and I hope this has been a blessing. It's good? No?
Bueno, terminamos con esta transmisión y les agradecemos a todos por estar atentos. Gracias, Brandon, por enseñarnos todas estas técnicas de hidroterapia. Nos vemos en otro video más.